Welcome back, everybody. The health of our parents or grandparents is one of the most important things in our lives.
And now the United Health Foundation is out with some rankings that paint a pretty clear picture of the overall health and well-being of our nation's seniors.
Here to talk about the specifics in our state is Dr. Rhonda Randall, Executive Vice President and Chief Medical Officer of UnitedHealthcare, employer and individual. Thank you so much for being with us.
Thank you for having me.
Can we start with the basics? What is the Americans Health Ranking Senior Report?
Well, we know that understanding the health of our nation's seniors is especially important as the country continues to respond to the pandemic. America's Health Ranking Senior Report is now in its 9th year. It looks at 49 different measures of our seniors' health from 22 different public health sources, from social and economic to our physical health, to the community and environment where we live, our health behaviors, and our health outcomes.
What did you find specifically about the seniors living here in Connecticut?
So in Connecticut, we see a mixed bag. Like all other states, there are strengths and there are challenges. In particular, Connecticut has a low poverty rate among seniors, but we also see some challenges like food and housing insecurity and a high rate of chronic conditions.
We better make sure we're taking care of them because according to your statistics, 54 million adults age 65 live in the United States, but by 2050, there's going to be 85.7 million. That's a lot of people.
You'll be one of them.
And I'll be one of them. You'll be one of them too by 2050.
That's true. And it's really important that policymakers and community leaders and public health officials, as well as us as individuals, all think about how to safeguard and improve the health of older Americans.
You know, I think there's some good news to celebrate, not that we don't need to work on the challenges, but I love that it says that Connecticut has ranked high. We're one of the 10 healthiest states for seniors.
Connecticut ranked high in a number of measures. In particular, you're 9th in the nation for a low poverty rate among seniors. You have a low prevalence of physical distress, ranked number 4th in the nation for that measure, and a high percentage of seniors who receive their flu shot. You're number 2. That makes me really happy to see.
Wow, that's really excellent. Can we talk about the mental and behavioral health of our seniors? That seems to be a little bit of a challenge, something where we probably should be working on.
That's true. These numbers predate the pandemic, and given the context of the social isolation that likely increased during the pandemic, it's important to understand what we were facing before we went into it. Seniors were experiencing a worsening number of behavioral health outcomes, a 39% increase in drug deaths, a 3% increase in suicides, and 11% increase in the reporting of frequent mental distress. All of those numbers were national before the pandemic.
Before the pandemic.
Okay. So obviously we have some work to do there. And what do you advise for the people who are listening at home who are worried about the health and well-being of their parents or grandparents?
Well, there's a lot that we can do about it. There's a lot of strengths to build on. We're also really happy to see some of the improvements that we've seen over the last report. We saw a 13% increase in the number of geriatric professionals. That's geriatricians like me and geriatric nurse practitioners like our partners at GAPNA who helped us provide the data in this year's report. We saw flu vaccines rise among seniors nationwide. But we still see some disparities among geography, race and ethnicity, and other factors.
Yeah, I was just reading that. The disparities by geography, health improvements for older adults were not experienced equally across the country. That's right?
That's right. So from state to state, from rural areas to urban areas, from looking at different genders, looking at race and ethnicity, looking at income levels for seniors, and education levels for seniors, we see disparities and variations in all of those measures for many of these reports.
So compared to other folks, like us, we're doing better in Connecticut. Why do you think why do you think we are strong in some of these areas in Connecticut? What do we have going for us system-wise?
So when you look at some of the areas that Connecticut does particularly well around some of the physical measures, flu shots, and good choices with behaviors, those ultimately lead to having less chronic conditions. Although we see a high number of seniors living with chronic conditions in Connecticut today, those leading indicators of physical activity, getting exercise, consuming fruits and vegetables give us hope that things would go in the right direction in the future.
And it still says we're struggling, though, with issues like food insecurity, housing insecurity, and a high rate of senior citizens living with chronic conditions. Is that true, Rhonda?
That's correct. Connecticut is 33rd in the nation for food insecurity, 46th in the nation for housing insecurity, and 31st in the nation for the number of seniors who have multiple chronic conditions.
Okay. Well, thank you so much.
A little bit of a mixed bag, but
it sounds like we're doing okay.
We all
Compared
have
to
strengths and weaknesses, but we're doing better than some.
Exactly.
And all of this information can be found on our website. It's americashealthrankings.org.
Yeah, okay. AmericaHealthRankings.org, right there on the screen, or at UnitedHealth GRP if you want to follow on social media. Thank you so much,
Doctor. We appreciate it.